We're joined now by Dr. Andrew Scott from Austin Health. Thank you so much for joining us today. Now, you're delivering the oncology and therapy highlights for this year's conference.
Yes.
Can you tell us a little bit about that?
Well, I'm very excited to be able to present the oncology and therapy highlights here at the SNMMI meeting. I think it's an enormously important time for nuclear medicine in the context of the four pillars. So along with cardiology, neurology and general nuclear medicine, we also have oncology. Here at this meeting, oncology is almost half of all of the abstracts which are actually submitted. And it's an extremely important area of clinical development that nuclear medicine engages with, both from a diagnostic and from a therapeutic perspective.
And what's new and different from last year?
I think there are a lot of things which are new and exciting in both diagnostic and therapeutic nuclear medicine that are on display here at the SNMMI meeting. The first is in a diagnostic setting. We're seeing theranostics emerging as extremely important, not just in neuroendocrine tumours, but increasingly in prostate cancer. So there's a strong group of presentations here looking at various types of gallium-68 and fluorine-18 labelled imaging agents in prostate cancer, but importantly looking at evidence, multi-centre studies that are generating the information that will enable these new diagnostic techniques to be approved. And again, linking them to incredibly important new therapeutic approaches, particularly with lutetium-177 labelled PSMA compounds.
What do you think are the most exciting developments in the area of oncology and therapy?
So I think that oncology is going through transformations both from the biology as well as the therapeutic space. So the last few years we've seen tremendous advances with immuno-oncology. So this is where therapies are being developed to stimulate the body's immune system to fight cancer. And we've seen dramatic changes in both response rates and survival rates in patients in a broad group of cancers that are being treated with immuno-oncology drugs. Now that's provided both a challenge and an opportunity for nuclear medicine, because we are therefore able to assist with assessing the therapeutic efficacy of these new treatments, and they are quite complicated, but also we can help in the development of new immuno-oncology drugs as well. So within the SNMMI meeting, we're seeing a number of new imaging approaches to understand the way the immune system is responding to these immuno-oncology drugs, and also to be able to assist with understanding response rates after treatment has actually occurred.
So where do you think we're going next? What's next in the next 10 to 20 years when it comes to oncology and therapy?
So I think we're really looking at a renaissance of therapeutic activity in nuclear medicine, particularly in the oncology space. And so being able to match in a theranostic way the imaging of different types of patients with different types of cancers, and selecting the treatment based on the phenotype of their cancer and the imaging properties to assist with both immuno-oncology or new therapeutics, or importantly, nuclear medicine-based therapeutics, such as with beta or alpha emitters, is really going to dramatically change the landscape in how we practice nuclear medicine and how we intersect with oncology patients.
Dr. Scott, thank you so much for joining us. We really appreciate it.
Thank you.